We are standing on the premises of the Pollsmoor Correctional Facility where a briefing was just finished by the National Commissioner of Correctional Services, Makgothi Thobakgale, who talked us through the outbreak of diphtheria here at the prison itself. But let's talk directly to the Commissioner. Thank you very much for your time, Commissioner. What is the situation right now regarding the outbreak of diphtheria?
The situation right now is that I have visited the center. I've visited the isolation facilities that we have, the hospital. I have been assured, also through what I saw, that the situation is under control. For the past 5 days, we have not had any new case. The inmates that are isolated are doing well. Majority of them do not show any symptoms. Also, the officials that had contact with the inmate that lost his life are not having any symptoms. They are isolating at home. Both those are receiving support and medical care from our health professionals. But apart from that, we work very closely with the Department of Health that has provided leadership and also the resources that we need, like vaccines. We have already vaccinated 243 inmates. The campaign is continuing. Secondly is to ensure that all our facilities maintain the standard of hygiene that is required without chance. Thirdly is to ensure that our hospitals have got the resources and the infrastructure that we built during the time of COVID doesn't get dismantled. So if we face any outbreak or any disaster, we know that already the facilities are in place. And lastly is the importance of health education, of communicating in a very simple and clear manner when we have an outbreak like this one. So I interacted with inmates. They understand in a very simple manner how diphtheria is transmitted. They understand in a very simple manner that they need to keep their own conditions, living conditions within their cells, very hygienic. They understand the importance of wearing a mask during the time of an outbreak like now, as we're trying to control it. But lastly, what we have learned is the speed at which we need to react to any sign of a symptom. And that's how we were able to put diphtheria here under control. So those are the lessons that we learned from COVID-19.
And in terms of understanding where this person might have contracted diphtheria, how is the investigation going?
The investigation is still ongoing. We obviously, through the Department of Health, have learned that there were outbreaks in 2 districts in the Western Cape. This inmate was a remandee. So the risk is always high because they go out on a daily basis to court. So it is very difficult to very soon be able to tell where the inmate might have contracted this. What we know is that each and every day when our remandees come back from court, we screen them because all of us are involved in the criminal justice system value chain. So that's what we do, so that all the other departments that might be affected can put in place measures to attend to that situation.
Lastly, just the issue of overcrowding. How do you address highly contractable disease like diphtheria in an overcrowded space such as Pollsmoor?
Pollsmoor, yes, of course, overcrowding is a deep-seated problem in the correctional services system. With Pollsmoor and with all our facilities, we have what we call hospital wings. They are there with, of course, limited number of beds to deal with any kind of an outbreak. But here at Pollsmoor, because of the population size, the infrastructure that we have put in place to deal with outbreaks is of a capacity that can handle what we are dealing with now. I have gone through on an operational visit, and I am, confident that the number of beds we have there are actually enough for any eventuality if we are to experience new cases. But as I've indicated, all the signs are pointing to no resurgence of any new case in this instance.
Thank you very much. That was the National Commissioner for Correctional Services, Makgothi Thobakgale, speaking to us about the outbreak of diphtheria. At this stage, he says it seems that it is under control, and many of the lessons learned during COVID-19 has been implemented in this case as well to curb the spread. As you heard from the Commissioner, overcrowding remains a major issue across all correctional facilities in the country, and more so at a place like Pollsmoor Correctional Facility, so immediately putting in place all measures to ensure that the spread does not go any further than the young man that unfortunately lost his life and the 8 other inmates that also tested positive for diphtheria. Also 3 of the correctional officers tested positive, and they are currently isolating. We understand they're on their 16th day of isolation to ensure that it doesn't spread any further. We ourselves had to wear masks when we went inside the facility for the press conference, and at this stage correctional facilities confident that they have a handle on the outbreak of diphtheria at Pollsmoor Correctional Facility.